Yellow's common mistakes people make when taking their blood pressure. There are 11 common mistakes people often make when checking their blood pressure at home. Surprisingly, some of these even happen at the doctor's office. These mistakes can lead to inaccurate readings. If the numbers come out higher than they really are, you might think you have high blood pressure or even be misdiagnosed, when in fact, you don't. So let's go through each one, step by step. Mistake number 1. Wearing the cuff over clothing. The cuff should always be placed directly on bare skin, not over a shirt or sweater. If you place it over clothing, the reading can be off by about 10 to 20 points, which is a big deal. Mistake number 2. Not keeping your arm at heart level. Your arm must be at the same level as your heart. If your arm is hanging down at your side, the cuff is lower than your heart, which can cause an inaccurate reading. The fix: rest your arm on a table or armrest so it's properly supported at heart level. Believe it or not, even in some clinics, blood pressure is taken with the arm dangling, which often produces false numbers. Mistake number 3. Using a cuff that's too tight or too loose. How do you know if the cuff is the right fit? If you can slip your whole hand under the cuff, it's far too loose. If you can fit 2 fingers, that's perfect. If you can't get 2 fingers in at all, it's too tight. Also, make sure the small mark labeled artery lines up with the inside of your arm, where your artery runs under the bicep. If the cuff is too tight, your blood pressure reading will come out artificially high. Mistake number 4. Not being rested by definition. High blood pressure means your blood pressure is elevated while your body is at rest. That's why you should never check it right after climbing stairs immediately after rushing into the doctor's office, or while you're feeling anxious, angry, or stressed. In all of these cases, your numbers will naturally be higher. The correct way, according to medical guidelines, is to sit quietly and relax for at least 5 to 10 minutes before measuring. This is also why many doctors take your blood pressure at the end of an appointment, once you've had time to calm down. If the nurse tries to take it right away, politely ask for a few minutes to sit quietly and do some deep breathing. Remember, your blood pressure should reflect your resting state, not your rushed or stressed state. Mistake number 5. Having a full bladder. Did you know a full bladder can raise your blood pressure reading? When your bladder is full, it activates your sympathetic nervous system, the same fight or flight response your body uses in stressful situations. This can make your blood pressure appear higher than it really is. The fix is simple. Empty your bladder before taking a measurement. Mistake number 6. Crossing your legs. Another common mistake is sitting with your legs crossed. This often happens without you even realizing it, and yes, even at the doctor's office. But crossing your legs can raise your numbers. The correct posture is to sit with your feet flat on the floor and legs uncrossed to ensure the most accurate reading. Mistake number 6, continued. Crossing your legs. If you're on the exam table at the doctor's office with your legs crossed, your blood pressure can read artificially higher, giving you inaccurate numbers. Make sure your feet are flat on the floor, supported, and your body is relaxed. Mistake number 7, drinking caffeine beforehand. Having caffeine, especially coffee, can raise your blood pressure. Coffee in particular can increase it by 20, 30, or even 40 points because caffeine stimulates the sympathetic nervous system and constricts blood vessels. It takes about 20 minutes after drinking coffee for it to start affecting your body, and the effect can last for hours. So if you're doing keto coffee or just having your morning cup an hour before a doctor's appointment, you're artificially raising your numbers, and your doctor may think you have hypertension because of it. Once the caffeine is in your system, you can't simply breathe it away. Deep breathing won't cancel it out. The solution: keep your stomach empty for about 2 to 3 hours before your appointment. Mistake number 8, using the wrong arm. This one drives me crazy. The nurse grabs the cuff and puts it on the right arm. I'm sitting there thinking, seriously? There needs to be standardization in how blood pressure is measured. The standard textbook method is to measure on the left arm. Yes, there are exceptions, such as if you've had surgery, have lymph node issues, or pain in the left arm. But otherwise, using the right arm is like taking your blood pressure on your ankle or thigh. It isn't the standard approach. Mistake number 9, using a wrist monitor instead of an arm cuff. The standard method is to measure blood pressure on the upper arm. There are cases where the arm cuff is uncomfortable, often because it's placed too tightly, pumped too much, or an automatic machine isn't sensitive to the person. In those situations, a wrist monitor can be used. Wrist monitors are viable, but they tend to be less accurate. They'll give you a ballpark figure. They won't say your blood pressure is well when it's actually 120/80. But they're not as precise as the proper upper arm method. You'll often see wrist monitors in dental offices because vitals are part of the exam and they get reimbursed for recording them. Dental hygienists usually work from the right side, so reaching the left arm can be awkward. Also, the true method requires you to be seated, relaxed for 5-10 minutes, and that kind of time isn't always available. So they put the cuff on, write down the numbers, submit the exam, and move on. Accuracy isn't the priority. Getting the numbers down is. Mistake number 10. Talking during the reading. It's frustrating when you're rushed into the room. The cuff goes on the wrong arm. It's placed over clothing. Your legs are dangling. You need to use the bathroom, and the nurse asks, "Why are you here today?" while the reading is taken. If you talk during a blood pressure test, you are very likely to get inaccurate numbers. Remember, a true blood pressure reading is meant to measure your resting blood pressure. Mistake number 11. The one-take, one-diagnosis approach. This can happen at home, and sometimes in a busy clinic. You take one reading, it's high, and you're labeled as having hypertension or put on medication based on that single measurement. That approach doesn't work. True high blood pressure means your blood pressure is elevated at rest, and it should be confirmed, not assumed from one high reading. In other words, don't make decisions from a one-take, one-diagnosis result. Recheck under proper resting conditions. Mistake number 11, continued. The one-take, one-diagnosis approach. True hypertension means your blood pressure is consistently high when you're resting, when you're active, in the morning, at night, even in the middle of the night. But the most important measure is when you're at rest. If you're calm, you've done everything right, and your numbers are still high, then yes, you may have hypertension. And if you're not planning to change your lifestyle, your diet, or habits like smoking, then medication may be the right choice for you. But here's the key. If your doctor takes just one blood pressure reading and immediately prescribes medication, that's a mistake. A proper diagnosis should be based on averages over time, multiple readings at different times of the day. That way, your doctor can see your true blood pressure pattern, whether you're relaxed at home, sitting in the clinic with white coat syndrome, or even after a meal. That's the correct way to diagnose hypertension. Learning how to use a blood pressure cuff at home is extremely valuable, but only if you measure it correctly and consistently. If you found this video helpful, please give it a thumbs up and subscribe to the How to Naturally Lower Blood Pressure channel. On the right side of the screen at the end of this video, I'll share another video that teaches you how to lower your blood pressure naturally. I should warn you, it's a long video, but take notes because it contains everything you need to know about managing your blood pressure without medications. Of course, if you want to take medication, that's your choice. But if you're interested in natural methods, that video will be very valuable. We also offer Zoom and phone consultations. Details are in the description below. There is a consultation fee. I'm a practicing doctor of chiropractic in Southern California with 28 years of experience helping people naturally lower their blood pressure. Lastly, if you'd like to support this channel, I also have a Patreon. I hope this video has been helpful. Now, go ahead and watch the next video. I put a lot of effort into it, and it's packed with information to help you take control of your health and lower your blood pressure naturally.